Okay, so the Semmes Weinstein Monofilament test is an assessment tool for neuropathy. It's a good tool for therapists to use to measure skin pressure thresholds, and it can give us good information about the degree of normal and protective sensation the client has.
So the monofilament test can be used for patients with neuropathy. So that can be anything from peripheral diabetes or Hansen's disease or leprosy or a burn victim. And the way that it works is you pick up the normal or the smallest filament first, and you test their area of sensation by pressing and watching it bend for 1 second, and you repeat that 3 times. So you make sure to occlude the patient's vision. You can either use a screen, or if you trust them, just tell them to close their eyes. And you do 3 trials, like 1, 2, 3, and ask them to respond by saying touch when they can feel the filament. So 1,
Touch,
2,
touch,
3.
touch. Okay, so you start with this 2.83. It's the smallest one, and this set is green. And you're going to do the test on them, and if they can feel it, then they have normal light touch and deep pressure sensitivity. They'll have a normal response. So, Mary, look away.
Touch.
Okay, so if she responds to 2 out of 3 of my trials, then she has a normal response. But if she does not have a normal response to that one, then we would move up to the next biggest one, which is 3.61. It's the blue one in this kit. And if they can only feel the 3.61 or greater, then they have early signs. They can only feel 3.61 or greater. It's a sign of early problems or a loss of sensitivity.
Touch.
Okay.
So moving from the 3.61 filament, you would move on to the 4.31 filament. It's a little bit thicker. And if they can only feel this or a greater filament, that means that they have a diminished protective sensation. So they might not have texture or temperature discrimination. So then if they can't feel 4.31, you move to 4.56. And if they can only feel this or greater, then you would grade that as a complete loss of protective sensation. It's dangerous. And then after that, if they can't feel that, you would move to T 6.65, and that one's like really thick. And if they can only respond to this one, then that means they're considered untestable.
So the therapist is going to record the responses on a grid. Usually it looks like this. It's probably going to come with the kit. And you're just going to start distally and move proximally when you're testing the areas of the hand, and you would just fill out your responses from the patient on this grid. And some therapists actually like to color code it so you can just get a better map of the neuropathy.
So this is the current version of the test that you'll see in most hand therapy clinics. It's 5 monofilaments, but you could also see the older version that has 20 monofilaments. That's the current version. The most important thing is that you test consistently, because you might also see instructions that say to randomize the area that you're testing in, or you would see the proximal to distal. There's a few different versions. So the main thing is just that you're consistent with your testing. And that's about it.